South Central Sports Medicine program involves a conglomeration of physicians and physical therapists and athletic trainers who seek to provide the best care they can for the athletes that we have in the Jones County and surrounding area.
Our job is to promote healthy attitudes, healthy lifestyle, healthy performance. To begin with, education of what's needed, what the athletes need to do to be the best they can without avoiding injuries at any cost. The second thing is to help them prevent that through taping of joints, providing braces, providing care, whatever that need be. Then it's in the emergency care, providing that if something were to happen when we're present on a field on a daily basis interacting with the athletes. Then to help them get not only the emergency care but the rehabilitation care in the physical therapy clinic on the athletic field. And with that, we've implemented our South Central Performance Plus program, which is going to be helping to enhance and prevent injuries by trying to promote a healthy lifestyle in teaching children, athletes, collegiate, high school, recreational, how to be the best athlete that they can be through stretching, through agility, through strength training, through proper swing movements for baseball, for proper kicking movements for soccer, whatever is required.
I love sports and medicine, and that kind of brought the two of them together. I always feel like if you're doing something you enjoy, you're not really working. It made life easy, being able to do something I really enjoy. I had an injury during my junior year of football that required me to see an orthopedic surgeon. From that experience, I expressed my interest in medicine in general at that time, and I was invited to come back at any time to shadow and just hang out and learn about the profession. During my senior year of high school, as well as during undergraduate, I would go back and spend time in the office with Dr. John Young. He would allow me to see patients with him, go to the operating room, and really just get the full spectrum of what orthopedic surgery was. From that, I continued to come back during undergraduate, and as I progressed through medical school, started my rotations in medical school. Nothing ever caught my interest the way that orthopedic surgery did, and just continued to pursue that dream.
I grew up playing sports. I was involved with sports throughout my life. Matter of fact, had some sports injuries that kind of got me interested in it. I was playing junior college and ended up having a knee injury that required surgery. And you go through the rehab process, and it's something that I enjoyed, and I thought it would be a good profession to go into. I enjoy being around the kids. I enjoy being around the athletes. There's a certain bond there between the athletes and the coaches, and even us as athletic trainers, where we're all involved in this together, and that's kind of the feel we want to get across.
My athletic career growing up, I enjoyed sports. I'm still competitive to this day, and I enjoy the sports activities, and I enjoy working around the athletes. I enjoy seeing them get better and return to the field in the best way that we can provide. It's a big part of my life. My children play in high school sports. They play in recreational sports. That's something that's very dear to me. It's something that I enjoy doing.
My history is, high school athlete that involves competition, enjoys competition.
I went to undergraduate at Xavier University in New Orleans. After that 4 years, I went to Washington, D.C., where I did my medical school as well as my surgery training. I actually did 1 year of general surgery before going into orthopedic surgery. Both were done at Howard University Hospital. I then chose to do my sports medicine fellowship to get further training on the arthroscopic techniques and surgical procedures that are involved in sports medicine. As an orthopedic surgeon, sports medicine specialist, I'm able to provide total care for the patient. A big deal with sports medicine is injury prevention, which is something that is often overlooked. We're often looked at someone that you go to when you need surgery, but we're also here to help you prevent having to have surgery by conditioning yourself properly to play your sport.
We cover anywhere from high school softball to high school football. We cover recreational tennis. We provide coverage to some area semi-pro soccer teams. We provide rehab coverage for our local junior colleges. So any realm of sports, we in some way or some fashion provide care, injury prevention, injury coverage, athletic event coverage, all the way up through the rehabilitation process to return to sports.
An example of what we'd do is on a Friday night football game, we go there, we take care of all their pregame needs such as taping, or if there's an athlete that we have to check to see if they're released to play. If someone is injured during the game, we will check that injury, see if they're able to continue to play. If not, we'll get them to the proper physician or orthopedic to see what we need to do with that athlete.
We're there. We're there from the get-go to the end. That's why we're there. We're there to help the coaches. We're help to educate the parents. We're there to help educate the athletes themselves to know when they need help.
Monday through Thursday, we go and visit the school. We make daily school visits. If a coach calls me and says, look, I've got a kid out here, I think he hurt his knee, we need to get him checked, I'll ride out there to the school and we will check him out. If it's something we think we need to pursue further, we will get that athlete in to see an orthopedic. If it's just a bruise, something like that, we can take care of those athletes at the school. Or if it's something we need to rehab, we actually just send them to the wellness centers of the clinic and rehab them there.
The goals of treating athletes is to return them to the best athletic performance that they can do to get back on the field.
Now we have athletes that play year-round. Many times the athlete is playing the same sport year-round instead of really having the cross-training that you need to have your body ready for your sport. So from that, we see a lot of overuse injuries. We also treat ligament tears. One of my favorite procedures is ACL reconstruction. We also treat injuries of the shoulder, which can go from tendonitis to rotator cuff tears. So a concussion is a traumatic brain injury that alters the level of consciousness of the athlete. It's usually misconceived by the athlete that if they don't lose consciousness, that they don't have a concussion. So it's a part of our training to be able to not listen to what the athlete is telling us, but to be able to watch their performance and to communicate with the coaches, communicate with the other players to try to pick up little signs and symptoms of the concussion. We know that the importance of treating concussions is if we do not treat the concussion properly when it first occurs, you can have what's called the second impact syndrome, which can lead to more serious injuries and even death in the athlete. It's important to have people on the sideline at all times, especially during the more collision type sports like football, even soccer. It's important to have people who are well trained to be there at the time that the injury occurs to make sure the patient is removed, the player is removed from competition. It's no longer a question of what we have to do when we recognize the signs or symptoms of a concussion. At that point, the player is done for that day, no questions asked.
I think we provide an excellent continuum of care for our athletes in the sense that we're able to get these athletes in quickly, get them to the proper physician they need to see, and we're able to maintain communication with the coaches and the families and the doctors. And it's just one circle there where we're able to keep that continuum of care going, and I think that's what makes us unique.
We have a Performance Plus program in our 5,000 square foot facility that's at the Wellness Center. And this particular facility is for the promotion and enhancement of an athlete's performance through stretching programs, strengthening programs, agility programs, and sport-specific programs.
Athletes are bigger, they're stronger, they're faster. Science has proven, technology has proven there are things we can do to promote enhancement, and we are thrilled here at South Central to be offering that to our local community, local athletes, recreational athletes, and whoever wishes to take part in that. We can help an athlete improve coordination, we can help improve mobility, we can help improve performance and the dynamics of the way they're running, or we can specialize through videography and improve the technique or the fundamentals of basic improvement, such as strengthening the core, strengthening the legs, improving fine motor coordination, improving gross overall strength, improving start-off speed. So it's just a whole array of different activities we can perform to improve that.
It's part of who you are. I get athletes that call me at home. I know we all do. They'll call us at home on a weekend, or, you know, I cut this, I did this, what do I need to do? And that's the avenue that we take to go to whatever doctor they need to go to or wherever else. We're also a liaison between the athletes and the parents and the coaches. Sometimes their communication isn't what it needs to be, and the athletes are scared that coach isn't going to play me because I got a cramp or whatever.
I want people to know that we're here, we're in the community.
We're in this with the athletes and the coaches and the schools, and we want them to know that we're there for them for any need they have sports medicine wise.
We are excited. We have the technology now, we have the space now, we have the personnel, and we're here to compete, and that's what we want to do, is compete with these other facilities.
At South Central Sports Medicine, we provide total care for the athlete. We will treat the athlete from even before the injury.
We're there. We're there for them. That's why we do what we do.